This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D. or Odyssey.
Talk Radio 1210 WPH.D, WPH.D, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to another adventure known as Health Watch. Here on Talk Radio 1210 WPHD. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We discuss here on the program, as you probably know, the who, what, when, where, why, and how of Innovative Medical Associates, how they are different, what they do, how they can help you potentially with any of your medical challenges or problems. And we'll do it all here on the program today between now and 9 o'clock. And as always, our number here in the studio, 855-839-1210 is the number here in the studio, 855-839-1210. If you have a question or a medical challenge you want to run by Dr. Molly, this is the time to call, 855-839-1210. And we say good morning to Dr. Molly.
Hey, John, it's always good to be here, assuming we can get on and get everything straightened out. It's amazing, isn't it? There's always it's nice thing about radio is there's always a little technical glitch here and there, and God bless us, we managed to get through
it. It's another
always right at the moment.
That's right.
Thank God.
We managed to get through another one. So
that's right.
Here we go. We're going to start off with, as we always do, what is the difference between innovative medical and what we would come to expect from a primary care physician or practice. So maybe you can talk about the differences.
First of all, we are a primary care facility, so that's step one. So in that we share our license with lots of hospitals and urgent care centers, those kinds of things. So we are a standalone primary care facility, and all of our healthcare providers believe in the innovative approach that we use, which happens to be hydration therapy. And with that, I want to say we use hydration therapy as a vehicle by which we are able to use nutraceuticals, natural products, whether they be vitamins, minerals, amino acids, herbs, whatever, and we utilize those by using hydration therapy as the vehicle to deliver those in order to really reduce your need for pharmaceuticals, not necessarily get you off them completely, take care of your medical challenge without putting you in harm's way, and actually giving you a better quality of life. And that's what it's all about.
And does the nutraceuticals effectuate change?
Yes, it can, especially delivered through hydration therapy, because you can then deliver absolutely the therapeutic dose that a patient needs in order to do that. And again, it's interesting. Therapeutic dose doesn't always mean higher. It means a dose that's just right for the patient, given the condition of the medical challenge. Everything has to be taken into consideration. But does it work? You bet.
And you have data to show
for
those who are coming for the initial consultation.
Right. But you know what the interesting thing is, John? We can talk about data from now, and as a scientist, I do. And certainly physicians rely on data. I always say physicians and scientists love to rely on the God of double-blind studies. But the bottom line is, you've got to really talk to patients in order to see how well this works. Yes, we can see improvement in blood work. We can see improvement in metabolics. We can see improvement in blood pressure, physiology. But the bottom line is, when you talk to our patients, we see real change in quality of life. And that's what we're all about.
All you have to do is look at me.
You're one of them. And you know what? It's so funny. Did we not see this week that a patient came in and said, hey, John really is a patient? He is. I said, of course he is. If you come in on a Tuesday or Thursday, you're going to see him there. Right?
That's right.
So the bottom line is, yes, it works, and it can work well. And in some respects, it can ease your pharmacology burden, which is very important. Because if you're taking multitude of drugs, let's say, which one can be giving you the side effect, which one isn't, and at what dose do those side effects happen?
I think about my father when I talk to you, because I follow what you say.
Well,
for the most part, yes.
Sure. My guys are smart docs, yes.
And my father was a great historian, but he drove a trolley. So he always thought he knew better than them.
Well, he might have.
But didn't live till past 74. So.
Well, yeah, therein lies the rub. I mean, the bottom line is you do need good advice with natural substances. Yes. Again, to say natural substances don't have side effects, that's ridiculous. Any more than saying pharmaceuticals don't have side effects. They all have side effects. And if you're using nutraceuticals as your pharmacology, or the constituent in there as the pharmacology, you need to know what you're putting together.
How many treatments when you get started? Because I know a lot of people call for the initial consultation, and they're wondering what they would get into, how many treatments, et cetera.
It's
ballpark.
Okay, ballpark. I'm going to say it depends on when you come in your continuum of your traditional care. I mean, obviously, if you have stage 4 cancer and you're just coming in and you've already done 5 rounds of chemo. Well, you know what? To get you back to having some of the results that we would look for may take as many as 10, 15, 20 treatments. But if you come in the beginning of your challenge, you might be able to slide by on 5. So the question becomes, when does the patient seek this type of therapy? And therein lies the rub.
And then, of course, I'm a lifer. So.
Oh, yeah, there are lifers. But also I have patients
But they're maintenance. A lot of them are maintenance.
I have people who go down to once every 3 months. I just had a patient come in and he said, hey, I need a tune-up. I said, you haven't been here for 2 months. He said, I felt great the whole time, but I'm starting to wean. I said, come on down.
Yeah.
And therein shows you how nutraceuticals can work in a pharmaceutical way.
What are some of the substances that you use? Let's take
Vitamins.
The main ones.
Vitamin C is one. That's like your favorite. But vitamin B, certain physiological vitamin Bs, D vitamin, amino acids. And today we're going to talk a little bit more about neurodegenerative diseases, which I'm seeing a lot of. But again, it's going to depend on what the patient wants. Here's another interesting thing, John. Your quality of life and mine may be 2 different things,
That's
right?
True.
I want to walk every day. I want to walk. I want to walk the boardwalk. I want to walk in town, in Philly. I want to walk. That's my quality of life. I get out, not just the air. I just want to walk and keep my legs going, right? The other portion of my quality of life is I want to maintain the control on my weight at this point.
Yes.
For you, I would say your quality of life is codependent on your blood pressure, your kidney function. There's so much more going on in that moment. So what is it for you? We want to keep that cancer at bay.
Right.
Right? And I do too, by the way. I want to keep a cancer at bay for me. But the bottom line is my quality of life tends to be improved by getting out and exercising a little bit and walking.
We are coming up on our first break of the morning. The show is called Health Watch, and it is here every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. The number here in the studio, and a few of you listened last week. I tell you to call early if you want to get in here, and they did. 855-839-1210 is the number here in the studio. 855-839-1210. Again, it's Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly and I return with more of today's program after these words. You're probably sitting there listening to this program and wondering, I'm not sure if this is for me or not. Well, this is a very simple solution. You call the operators who are standing by right now at Innovative Medical Associates, 856-489-0505. That's 856-489-0505. And you schedule the initial consultation with Dr. Molly. It is complimentary. And you will learn a lot, whether it can help you or not, or all about the clinic and what they do and how they do it and why they do it. It's just a fascinating half hour of Dr. Molly's time, and she's willing to do that for you. 856-489-0505, the number. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is our number here in the studio. And we're going to talk about something that really you see a lot of today, and that's depression.
Yeah, I've been seeing a lot of patients with depression. It's amazing.
Is there any way, does this help?
Oh, yeah. First, I John, one of the things about depression is you'll hear Dr. Molly tell you, don't ever get off your antidepressants alone. You need to make sure you have good, solid help from your psychiatrist or your medical doctor who's helping you, along with my docs who will help you with this. We don't tell anybody get off their anti-anxieties or their antidepressants. But, it's an interesting thing. I do a lot of thinking in terms of things like what happens when we take drugs, and there's a ton of data out there that says drug-induced nutrient deficiencies occur. Now think about that. In other words, our body utilizes nutraceuticals or utilizes our own nutrition in our bodies physiologically. You've heard me talk about that last week.
Yes.
Physiologically re-regulating the body. Well, of course, we do that with natural substances. But imagine taking drugs, and probably the most well-known one, and you know about this, anybody who has a cardiologist who's taking the statin drugs knows that, guess what goes down? Coenzyme Q10, right?
Yes.
Well, think about that across the board, and think about that even more clearly with neuro drugs and psychiatric drugs, because there's a lot going on in our brain, all right? It's not just there to make us look pretty and think quickly when we're out on dates or having fun. No, it's there to keep a lot of our rest of our system working properly. So, indeed, I think about this. And an interesting thing is that there are new things that are coming out and old things that were around for a long time that we haven't been using to help patients who are on these particular substances, meaning the antidepressants, the anti-anxieties. One of the things that we put into our hydration therapy is now we're going to be using photobiomodulation. Photobiomodulation, big word, don't get afraid. It really has to do with light therapy. And if you have a depression that comes on with seasonal,
yes,
you already know about light therapy,
yes,
right?
Yes.
Sit under the light, you start to
lights.
feel, yeah, the mood lights, exactly. But since 1967, there have been 4,000 studies, at least 4,000 studies, proving that this particular therapy can help with people with the seasonal and other depressions and anxiety. So I started thinking about, hey, putting together the drug-induced nutrient deficiencies and this photo light. So we finally have the protocol in place. Dr. Pat and I and Dr. Linda and I and the whole group, we've put this together. And now we're doing a combination therapy where we're using this photobiomodulation along with IV hydration to address both the nutraceutical deficiencies that people have or the nutritional deficiencies. And by the way, there are countless of them depending on the type of drugs you're using. And I'll just go over a few of those. But in using the photobiomodulation, and by the way, just a side note, you know how I think, John, crazy, okay? This photobiomodulation, lots of the work was done right here in Philadelphia. And that is an interesting thing. So, and it resonated with me because it came out of Temple as well. So there is a lot to be said for using this combined therapeutic process.
This is fascinating, and I've always said you can see that your wheels are turning.
Even
like
now.
You walk into the clinic and you're saying hello to patients and how they're doing. But I see your wheels turning all the time.
Yeah, I'm always thinking.
So this is nothing new to me, and I'm sure the audience as well.
Well, I think it is. I think that although photobiomodulation has been around, which is sort of laser light, okay, it's been around for a long time, since 1967. It probably hasn't been looked at as it's always been looked at as a standalone therapy. And what I intend to do is utilize this along with what we're doing, because I know that the data supports using this to improve oxygenation to the brain, which is very important to deliver the nutrients, right?
Yes.
So think about this, utilizing some of our therapies and utilizing our neuroamino acids, utilizing our B vitamins in the physiological doses, right? Like the methylated B12s, using glutathione. So what we found is that these particular drugs that a lot of these patients are on, what came first? Did they already have a nutritional deficiency and then had to be put on these particular psychiatric drugs? Or did the psychiatric drugs reduce their particular vitamins, minerals, etc.? And every patient that I've done, since we've done this, and I was testing this for the last 3 or 4 weeks, as you know, in the back there on certain patients, young and older, I found that running their micronutrient panel prior to using this photo biomodulation and our hydration therapies, they all suffered from some dysregulation with their regular vitamins in terms of the physiological vitamins. Vitamin C was depleted, B3 was depleted, minerals were depleted. And so after I ran this and did this therapy with the hydration, rerunning the micronutrients, we found that they came back to physiological homeostasis.
Is that because they were on drugs before?
Well, they're on drugs now.
Yeah, but before you weren't addressing the problem.
No, because you would see that everybody has this. Again, in my own family, I have someone who takes an anti-anxiety and antidepressant, and she's had consistently low D vitamins, several other Bs as well. And so and the longer we're on these drugs without addressing the nutritional piece, the more likely they're going to have this in non-physiological amounts that are necessary for the body and the brain to operate.
So is it logical then that if anyone wants to use you or call you or whatever, if they're on these kinds of drugs, that they may very likely have a nutritional deficiency
as well?
Okay.
Sure. And guess what? Sometimes just cleaning up the nutritional deficiency actually helps the particular pharmacology work better. Think about that.
Yes.
Okay, so people can use a less dose. As a matter of fact, we worked with a young man who was 19, and he was on a very heavy antidepressant. By the time we were done with this, he was managed to go back to what they considered a subclinical dose of the antidepressant, as well as continuing on the nutritional journey and using the photobiomodulation.
So it really does work, and it works hand in hand.
Yes. So could a huge underlying cause of mental health issues be the fact that you have low nutritional status, and be the fact that you're not getting enough oxygen to the brain? I believe that absolutely it's one of the causes. And so I'm lucky enough to have physicians who think out of the box and say, yeah, let's try this. We know from reading all the data that the photobiomodulation, and again, don't worry about the word. It just means it's light, it's working on the biochemical systems, and it's modulating your biochemical systems in your brain. Don't be afraid of the word, okay? It's a laser treatment. Very painless, very easy.
And it is logical then that you do that.
Yes.
Because
why we're doing that is why we put you on this particular instrument while you're actually finishing up an IV, this kind of thing, to enhance the IV outcome.
We are coming up on our halfway point of the show, and as I always say, time flies when you're having fun, huh? It is Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number here in the studio. We do have some open lines, so if you want to get in here right away, you can do that. 855-839-1210. Again, Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. I'm your host, John DeMasi. Dr. Molly and I return with more of today's Health Watch after these words. Operator standing by right now at Innovative Medical Associates, and the number 856-489-0505. Again, 856-489-0505. When you call, all you want to do is really schedule the initial consultation with Dr. Molly, and you will learn a lot about what she does and how maybe she can help you with whatever your problem happens to be. 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. Our show is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. Our number here in the studio, you can talk to Dr. Molly right now, 855-839-1210, 855-839-1210. And we were talking about nutrition and depression, and what are some of the things that you use?
Oh, sure, John.
In this particular
protocol? Sure.
Yeah.
Of course, I'm using a lot of the methylated B vitamins because we want them to be physiologically the same as what we have. I use things like taurine because it lowers some of the homocysteine that can then also contribute to inflammation in the brain. I think what I want to tell people is that utilizing the light therapy and the hydration therapy is very important for proper mitochondria function and the ATP, which is the energy production both in the brain and everywhere in the body. You know that. You always heard me hear mitochondria is what? The powerhouse of the cell.
That's right.
And again, this is another case where inflammation on the brain or inflammation in the brain, I'm saying low-level inflammation. This isn't like if you go in and you're in the middle of a cytokine storm. I'm saying low-level over time can contribute to this reduction in your mitochondria function. So again, in this case, what? Inflammation is the enemy, right?
Yes.
It's how we eat, how we live. It's just and taking medication can contribute, which is why you see the reduction in the physiological substances that we need. So here we go again. When we got to look at the prevention and the elimination of several of the neurological issues and mental disorders, and that includes Alzheimer's, because we know that there's plaquing involved in that, right? Wouldn't you think that the plaquing would, of course, cause inflammation?
Yes.
So there are so many things. Parkinson's is one of the diseases. MS is one of the diseases that we look at. Neurodegenerative diseases. So we use things like curcumin. We might use things like a certain type of arginine. We may use a vitamin E, though, very carefully. How about an Indian herb called bicopa? I love bicopa. Bicopa, it's used in the Asian cultures a lot for their children. It's like part of their multivitamin because it improves memory. So, again, vitamin D. Saw it in my own family. Vitamin D level, that was bad. And as a result, they had bad bone issues because they've been on something so long. Vitamin B and, of course, vitamin A and the amino acids. Very, very important because the amino acids have a relationship with getting some of the neurotransmitters together. Industol might be something that we need to use. Glutathione, one of my favorites. So when you ask what's in these things, it's going to depend again on the patient. It's going to depend on what the drugs they're on, if any. It's going to depend on what it is in their quality of life and their quality of, in terms of their brain power, I want to say, they want to improve. And that's going to help me drive what is going to be in their recipe.
Is NAD part of this?
Oh, yeah, I love NAD. We have right now, I just started a very wonderful physician on NAD, and I'm anxious to hear what she has to say in the next few weeks. It takes a little time because NAD can have some really wonderful type results in terms of memory and stroke recovery, memory and stroke recovery. So again, there's many things. L-carnitine might be something we use. I am going to tell people, and of course, all the anti-inflammatories and the antioxidants. So there's not one size fits all with this. The only consistent thing in this protocol would be the photomodulation. That we would use for each and every patient. But even that, we don't use at the same band length for each thing we're trying to improve. In other words, there are widths there. So, for example, for memory, we might dial it one way. For people who have anxiety, etc., we're going to dial it another way, along with what we're using in the bag.
Can you tell us what photomodulation is?
Again, I'll tell you again, it sounds like a very scary thing, but it's photobiomodulation, and what it does is it's light therapy. We've all seen it. We've all heard about it. You use it for people who've had, the seasonal depression. It is done for the mitochondria support, okay? And what happens is the light actually converts some of the protons into ATP, which is energy. So it helps the mitochondria.
It's just so
cool.
fascinating.
And then
it really
add
is.
the fuel. Listen, then you add the hydration as the fuel for that ATP, and what do you got? You got super. You don't just have low. You don't just have regular. Now you got super. And that was when we see the change. Have to use it carefully. Have to know what kind of wavelengths you want to put people in. Yeah, there's a study to this, which I've been doing. I've got to tell you. And then I have a little trick, too, that we use in our clinic, because you know how I love physiological re-regulating medicines.
I was just about to ask you that. Yeah.
Right? Low dose meds, right? Love it. And they really work. They work on the BDNF, which is the brain neurotropic factor, and nerve growth factors. So guess what? There's some use to this when it crosses over into people who have some pain.
So re-regulated medicines or substances,
They're
they were
homeopathic.
intended for something else, and you're using it for something else.
Correct.
Yes.
We're using it a little differently, okay? But we have them, and that's the key to this. We have tinctures that utilize this. Listen, LDN is re-regulating. It's re-regulating on the opioid chain. So we use things differently, maybe in lower doses, right? Microdoses, but they work, and they work intensively better with the photolight therapy as well as the hydration therapy.
So you put all of these ingredients together.
That's right.
And you
have
really,
super. You have super
really,
test, right?
Right.
Right? You got 93, and that's what I want to tell people. Don't be afraid of this. What you want to do is use it properly. And you don't want to just go out and buy these things off the internet. You want to get some advice, right? Listen, you can go on the internet and buy a million lasers. You've seen it, right?
Yes.
How do you know what's good? How do you know what's good, and how do you know what band length they have? I mean, you got to know these things before you go out and do this.
That reminds me of a story. Speaking of the internet, I was at a convention many years ago.
Oh boy, John! I know this
and the
story.
guy says to me, "Take these pills." He says, "You're going to have sex for 3 days straight."
I remember that.
And I said, something told me, "Take these to Dr. Molly." She said, "You don't have to worry about having sex for 3 days. You might not live for
you
two."
Won't you won't live after mixing that up with your present pharmacology. That is the issue, and that's the issue with everything. What we want to do is optimize. Look, we're not telling anybody ever to get off their medications. What we want to do is optimize their quality of life and not hurt them, maybe reduce some of those. And since that time, actually, we've helped you reduce some of your medication. Yes, you may have a little combined. Lots of my patients, as we get older, may be on 2 drugs or 3 drugs even, but certainly in less dose than the conventionalists.
Yes.
Yeah, and there it is. And as we do that, can you imagine bringing in new technology for brain and mental health benefits? I love it, because that's a big part of our health in terms of our quality of life.
Bottom line is, don't start taking things without advice.
And don't necessarily buy all these things off the internet, like these lasers on the internet, because they say they're going to do you good. Let's look at what really will do you well and what band lengths you need. And maybe it's not that alone. And that's what I'm saying. We have to look at the nutritional piece too.
And with that, we come up on, I guess this is our final break of the morning. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number here in the studio. We still have time to take one or two more of your calls if you are so desired. 855-839-1210. Again, Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly and I return with more of today's Health Watch after these words. We are back here on Health Watch, and again, operators are standing by at Innovative Medical Associates. 856-489-0505. Now, don't think that they go home after 9 o'clock. No, we go off the air, but they don't. I mean, they're there all day. 856-489-0505 is the number. That's when you schedule the initial consultation with Dr. Molly. It is complimentary, and you will learn a lot, believe me when I tell you. 856-489-0505 is the number. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you missed any of today's show or you just want to hear it again, our Health Watch replay this afternoon from 4 until 5, right here on Talk Radio 1210 WPHT. Couple of minutes left of the show. 855-839-1210 is our number here in the studio, 855-839-1210. At this point in the show, we like to talk about patients and give you an update and let you know how they're doing and how well they're doing, actually. We want to start off with Jessica.
Yeah, so she's a young woman, young mother. She came to me with very intelligent gal. She married to a nurse. And she said, listen, she has breast cancer that unfortunately spread. She did have the surgery. She did not want to do any conventional. She and her husband discussed it. They didn't want to do too much in the way of conventional. They had consulted a functional medicine doctor, and the doctor had suggested that she do some vitamin C therapy with someone and had suggested us. So, of course, we followed what the other doctor wanted. My docs don't like to reinvent the wheel. If you're being seen by somebody, it's great. Interestingly enough, though, during the course of this, I find out that she tests positive for a mold problem in addition to having the cancer. So, what came first, the mold or the cancer? I think the inflammation came first, no matter what.
Yes.
So it turned out that we actually had to do a environmental medicine protocol on her, as well as utilizing the cancer protocol. And this is a dilemma I see a lot of time because people come in with comorbidities. And the idea is you really have to start to prioritize what are we treating and then how do we go about it? Because again, it's not one IV drip that does this. In other words, it's not just the vitamin C, but there are other things we need to do, obviously to address the cancer problem and inflammation, and then ultimately to address what was going on with the environmental toxins and making sure she gets them out. So this was a very long haul, but she's now down to once every 45 days. Now, this is interesting. She doesn't come on a month. She comes around 45 to 50 days, comes in for her follow-up. Doing very well. Her cancer markers are down, and we just ran, again, the mold testing and that kind of thing. All the environmental stuff is out. So here again, I want to say, it's not one size fits all in our clinic. We prioritize. We do IV therapies for that. We'll included in that might be some homeopathic, maybe some subclinical or reused or repurposed pharmaceutical. So there's a lot that goes into each and every patient. It isn't. You just can't say, oh yeah, take some vitamin C.
We have a caller, and it's our favorite caller on the show, one of our favorites, Frank in the Northeast. Frank, good morning.
Hi, Frank.
Welcome to Health Watch.
How are you, Frank?
Hello.
I'm here.
Oh,
okay.
Hi, Frank. Go ahead.
You're on with Dr. Molly.
Hi, bud.
Good morning, Frank.
There was a cat there. Good morning, Donnie and Bert. I mean, Sonny and Sarah. I mean, Dr. Molly and John.
Oh, thank you.
I get these all mixed up.
It's all-
These duos.
Oh, no.
Dr.
We got to work on that. Come on.
These are much better, trust me.
Yeah.
Dr. Molly, your show today, they're all great. I missed the first 15 minutes. I can't wait for the repeat. It's a fantastic one about the nutrition you're talking about.
Sure.
Dr. Molly, keep me in your prayers. I'm
Yes.
okay now. I was discharged yesterday from the hospital. I went in on Wednesday. The nurse saw me on Tuesday for my ulcer.
Yeah.
It got bad really quick. My ulcer measurement is one big one. It was 5 centimeters by 7 centimeters by 0.4 centimeters deep. It was red to the ankle. I had to get IV antibiotics. It was looking better day by day. So just keep me in your prayers.
I will. Frank, I'm glad to hear you're out, too. We don't want to stay in longer than we need to, as you know, today in particular, right?
It then
Thank
is one of
God.
3 days of antibiotics. I was getting them like once, twice a day, and once 4 times a day.
Okay.
And it was looking better every day. So.
God bless. God
But
bless.
I just want to say hi. I never miss calling in when I can because I love the both of you guys and all you great listeners.
Thank
and
you.
have a great one, okay?
You
God
too,
bless
Frank,
you.
and
Oh,
good
thank
luck
you,
with
Mama.
that.
I was wondering
Thanks.
why we didn't hear from him
Yeah,
at the clinic.
yeah.
I'm sorry that he had this problem. But again, there's another instance, you think things are under control and then all of a sudden it goes sideways, John. And that can happen. You know that.
By the
Quickly.
way, speaking of mold, you were
Yeah.
talking about that could be deadly.
Oh my gosh!
It
Yes,
really is a
environmental issues.
serious-
Listen, I am convinced. I am convinced that environmental issues help spark the inflammation, the negative inflammation that we have in our body. I am convinced of this, and I see more and more people who have these cytokines that are out of whack because of things like exposure to mold and exposure to toxins. Listen, how about just all the thing is it's an interesting thing because how about all the exposures we have in the air? We don't even know what's in the air today when we're breathing something. The bottom line is you've got to be aware of this, not just for the brain, but for your entire body. And I will tell you that I do see a lot of it. And, of course, the environmental protocols are pretty interesting based on work from Dr. Schumacher out of Maryland a long time ago. He did the pioneering work in this. So environmental medicine is a big part of what we do as well.
There was a young man you wanted to give us an update on?
My young man, Lynn. He's such a nice young kid. His mom called. He's 17 years old. We again put him on our anti-depression protocol. And, of course, he had very, very severe micronutritional defects. And, of course, straightening out his nutrition, utilizing the photobio modulation helped him. And indeed, he's home. He's doing well. He went back to school. He's doing great. And his mom said his mood has completely changed.
What would be the follow-up for him?
Oh, he's coming back in 3 months.
And-
That's the
and-
bottom line. And, of course, we talk weekly. So that's the thing. Just because you're not in the clinic doesn't mean I don't check in with you. We do. I ask people to call, and if I can't take the call in that moment, sometime during the day, I will call them back and get a recheck on how are you doing. I want to know. Quality of life, brother.
And I know you get calls on the weekend.
I do, and I don't mind them. I just know that people want to feel better, and that's our whole deal.
And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators standing by right now, and they will be there well after we leave you at 9 o'clock, 856-489-0505. That's the number. Set up that initial consultation with Dr. Molly. You will be very pleased that you did. 856-489-0505. Check out the website, innovativemedicalassociates.com, innovativemedicalassociates.com. Don't forget, you can hear our Health Watch replay this afternoon, 4 to 5. It's the same show. We're just playing it again. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Lana, Donna, Jess, and Jim. And then, of course, there's Joanne, Delightful D, Fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thank you for listening. We will talk to you next Sunday. Another version of Health Watch right here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.